Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's November 2024 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice this month is an original article entitled Safety of Triptans in Patients Who Have or Are at High Risk of Cardiovascular Disease, a target trial emulation. It is authored by Dr. Zhen Wang and colleagues from Mayo Clinic in Rochester, Minnesota, and Scottsdale, Arizona. Migraine is a distressing, debilitating disorder that affects more than 40 million Americans and more than 1 billion people globally. Triptans are highly effective drugs in aborting acute migraine attacks, being considered by various guidelines as either first-line or second-line treatment for such attacks. Triptans block serotonin receptors with at least 2 salutary effects in aborting migraine: the interruption of nociceptive neurotransmission and the constriction of the vasodilated cranial vasculature. Triptans can be administered orally, intranasally, or subcutaneously. Because triptans can be vasoconstrictive, they are generally contraindicated in patients with cardiovascular disease or hypertension. However, patients with such conditions are commonly excluded from clinical trials involving patients with migraine. Thus, there is a relative scarcity of literature regarding the risk for major adverse cardiovascular events, MACE, in patients with underlying cardiovascular disease or risk factors for cardiovascular disease when treated with triptans for migraine. The important study by Wang et al. Addresses this void by a target trial emulation based on clinical data retrieved from Mayo Clinic electronic health records on adults with migraine and a history of cardiovascular disease or cerebrovascular disease, or at least 2 risk factors for cardiovascular disease. Wang et al. Assessed MACE at 60 days in more than 3,500 patients treated with triptans, and in the same number of matched patients who received standard of care excluding triptans. The triptan group at this time point had a significantly high incidence of MACE, non-fatal myocardial infarction, heart failure, and non-fatal stroke. Similar findings were observed in subgroup analyses confined to sumatriptan, orally administered triptan, patients with chronic migraine, patients with prior cardiovascular disease, or patients with prior cerebrovascular disease. In discussing their findings, Wang et al. Recommend the continued avoidance of triptans in patients with a history of cardiovascular disease or risk factors for cardiovascular disease. However, they also note that the incidence of MACE in the triptan-treated group was relatively low at 1.48% compared with 0.37% in the non-triptan group. In view of this finding, as well as the efficacy of triptans for acute migraine, Wang et al. Discussed the importance of shared decision-making regarding the use of triptans in this setting. Finally, Wang et al. Underscored the need for novel therapies for acute migraine without risk for cardiovascular disease, as there are more than 3 million adults in the United States with migraine, as well as a history of cardiovascular disease or risk factors for cardiovascular disease. A recent review in Mayo Clinic Proceedings by Ashina et al. Discusses present and emerging therapies for migraine. Our first highlight article this month is an original article entitled Prevalence, Penetrance, and Phenotypic Manifestation of Cardiomyopathy-Associated Genetic Variants in the General Population. Insights from a Mayo Clinic Biobank Study. It is authored by Dr. Marta Figueral from Mayo Clinic in Rochester, Minnesota, and colleagues from Mayo Clinic, Minnesota, and the University of Trieste in Italy. The pathogenesis and clinical manifestations of certain cardiomyopathies, including hypertrophic cardiomyopathy, may be, at least in part, genetically determined. Figueral et al. Undertook their study in individuals who sought medical care at a quaternary medical center. The cohort studied involved 983 randomly selected participants in the Mayo Clinic biobank who underwent whole genome sequencing and were extensively phenotyped in the years of medical care at Mayo Clinic. A panel of 15 cardiomyopathy-related genes, as listed by the American College of Medical Genetics and Genomics, was employed. Prioritization of genes was performed by an internally developed pipeline in the identification of potentially reportable variants, and such variants were manually reviewed by interpretation specialists. Likely pathogenic or pathogenic variants were correlated with the clinical phenotype. The findings of Figueral et al. Demonstrate that some 1% of the cohort was genotype positive, with 11 likely pathogenic or pathogenic variants found in 5 specific cardiomyopathy-related genes. These genotype-positive individuals underwent artificial intelligence-enabled ECG for prediction of reduced left ventricular ejection fraction and hypertrophic cardiomyopathy. Echocardiographic findings were also available in the majority of these genotype-positive participants. In 36% of genotype-positive patients, definitive disease penetrance, as reflected by heart failure or cardiomyopathy, was present, with possible penetrance present in 27%. 36% of genotype-positive individuals exhibited arrhythmias and/or cardiac conduction disease. The AI-enabled ECG was positive for hypertrophic cardiomyopathy or reduced left ventricular ejection fraction in 45% of genotype-positive individuals. Interestingly, over 50% of participants with likely pathogenic or pathogenic variants, when informed of these findings, chose not to pursue genetic counseling or further evaluation. The salient findings of this timely study include the following. First, while the prevalence of likely pathogenic or pathogenic variants is low, the penetrance for relative disease is relatively high in this patient population. Second, this study shows how an AI-enabled ECG may be used to predict the penetrance of cardiac disease. Third, this study underscores the strength of the approach founded on a quaternary medical center-based biobank, as phenotypic characterization is usually comprehensive, especially when based on years of medical follow-up. Fourth, genetic testing may aid in establishing the correct diagnosis with regards to an underlying cardiomyopathy. Finally, this study discloses unanticipated responses from participants when informed of incidental findings from preemptive genetic testing. Preemptive and commercial genetic testing is growing considerably in its availability and appeal. The study of Figueral et al. Provides new and important information relevant to the occurrence of genetically based cardiomyopathy in a general population. Our second highlight article this month is an original article entitled Impact of Cardiorespiratory Fitness on COVID-19 Related Outcomes, the Exercise Testing and Health Outcomes Study, ETHOS. It is authored by Dr. Jonathan Myers from the Veteran Affairs Palo Alto Healthcare System, Cardiology Division at Stanford University in Palo Alto, California, and colleagues from several national and international universities and institutions. During the COVID-19 pandemic, a number of studies identified risk factors for poor outcomes in patients with COVID-19 infection. These include cardiovascular disease, hypertension, smoking, diabetes, obesity, and physical inactivity. The present study of Mayo et al. Is a retrospective analysis of the association of cardiorespiratory fitness determined by a maximal exercise test and outcomes in patients who subsequently developed a confirmed COVID-19 infection. This study was based on the Exercise Testing and Health Outcomes Study, ETHOS, which was begun in 1999 and included 2 Veterans Administration medical centers. Mayo et al. Identified more than 23,000 patients who tested positive for COVID-19. Based on cardiorespiratory fitness, patients were categorized into 5 levels of fitness, ranging from least fit to high fit groups. In these patients, COVID-19 related mortality progressively decreased as cardiorespiratory fitness increased. Additionally, hospitalization rates and the need for mechanical ventilation for respiratory failure will also decrease as cardiorespiratory fitness increased. Furthermore, this association of improved outcomes as cardiorespiratory fitness increased held true in analyses involving specific subgroups, including elderly patients and patients with cardiovascular disease, hypertension, diabetes, or chronic kidney disease. Indeed, after full adjustment, mortality decreased some 50% in the high fit group compared with the least fit group for each of these conditions. In discussing the possible basis for the protective effect of cardiorespiratory fitness on outcomes in COVID-19, Mayo et al. Point out that cardiorespiratory fitness tends to suppress systemic inflammation and to promote immune function, both of which may interrupt pathways whereby COVID-19 infection causes tissue injury and mortality. They also point out that individuals with higher levels of cardiorespiratory fitness tend to develop an augmented antibody response following vaccination, generally have improved respiratory and cardiovascular function, and are usually more resistant to acute infections and other stressors. The study of Mayo et al. Is particularly important and timely for several reasons. First, this is one of the largest, if not the largest, study of the association between COVID-19 related outcomes and cardiorespiratory fitness. Second, this study objectively evaluated cardiorespiratory fitness by a maximal exercise test. Third, the protective effect of cardiorespiratory fitness in COVID-19 infection held true across groups based on age, BMI, and relevant comorbidities. Fourth, this study shows how outcomes from yet another non-cardiorespiratory condition may be improved by higher levels of cardiorespiratory fitness. Finally, this study has far-ranging implications for public health, as cardiorespiratory fitness can be readily improved simply by undertaking regular and recommended levels of physical activity. You can access these highlights and editor's choice articles free of charge during the entire month of November. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find our online-only features and many news stories posted in News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online in press. You will also find links to our social media by clicking the links in the gray bar at the top of the homepage from the Connect menu to follow us on Facebook, X, formerly known as Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights, and our MCP 60 seconds video article synopses. Our website also includes our Mayo Clinic Proceedings issue summary and Author Insights podcast recordings, which are available from our website on the homepage as well as through iTunes. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.